Thank you for listening to Depictions Media Radio.
During the Q&A session following the opening remarks. In the room, we have with us right now Dr. Maria Van Kerkhove, Technical Lead for COVID-19, Dr. Soumya Swaminathan, our Chief Scientist, Dr. Mariangelo Shimal, and Dr. Bruce Aylward, who is the lead for the ACT Accelerator. We also have a number of our experts online. And as ever, we're providing simultaneous translation in the 6 official UN languages, so please use the opportunity to ask your questions and listen in the languages of your preference. And I thank the interpreters in advance for their extraordinary work. And now, without further ado, I will hand over to Dr. Tedros for his opening remarks. Dr. Tedros, you have the floor.
Thank you, Margareta. Good morning, good afternoon, and good evening. First, it's a great honor to welcome His Excellency Jonas Gahr Støre, the new Prime Minister of Norway. Tusen takk for joining us. And Your Excellency, congratulations on your election, and thank you for joining us again today. Gratulerer, Statsminister, and we look forward to your comments in a few moments. The global number of reported cases and deaths from COVID-19 is now increasing for the first time in 2 months, driven by an ongoing rise in Europe that outweighs declines in other regions. It's another reminder that the COVID-19 pandemic is far from over. The pandemic persists in large part because inequitable access to tools persists. 80 times more tests and 30 times more vaccines have been administered in high-income countries than low-income countries. If the 6.8 billion vaccine doses administered globally so far had been distributed equitably, we would have reached our 40% target in every country by now. As it is, health workers and vulnerable people in low and middle-income countries remain unprotected. Oxygen isn't getting to those who need it, and a lack of testing is leaving many countries blind to how the virus is circulating and the world blind to emerging variants. This is the scenario that the Access to COVID-19 Tools Accelerator was set up last year to prevent. And we have shown that the ACT Accelerator works. So far, WHO and our partners have delivered 425 million vaccine doses to 144 countries through COVAX, including 300 million doses just in the past 4 months. We have delivered more than 128 million tests, and we have increased the supply of oxygen, personal protective equipment, and treatments, including nearly 3 million doses of dexamethasone. But the ACT Accelerator has so far been prevented from fulfilling its potential by severe supply and financing constraints. Unless the pandemic is controlled everywhere, the virus will mutate and continue to circulate everywhere. All countries, including high-income countries, are at continued high risk of being exposed to new variants, infecting those who are fully vaccinated, risking the effectiveness of the tools we have, and risking the introduction of more stringent public health measures. The high transmissibility of the Delta variant has reinforced what we have been saying since we set up the ACT Accelerator. Vaccines alone will not end the pandemic. We need all tools vaccines, tests, treatments, PPE, and public health measures to fight COVID-19 and save lives and livelihoods now. Alongside vaccination, testing is needed to identify disease hotspots, track the emergence of new, dangerous variants, and guide the use of COVID-19 treatments. Treatments, including medical oxygen, are needed especially for those severely affected by COVID-19 and for at-risk groups. And we need effective health systems to turn vaccines into vaccinations and tests into testing. WHO is working with our partners in countries to use these tools most effectively. For all of this, the ACT Accelerator must be fully funded and fully enabled. Global coordination is the only way to defeat this virus. Market forces and bilateral deals alone will not close the equity gap. Today, we're releasing the new plan and budget for the ACT Accelerator with an ask of $23.4 billion to meet our global targets and deliver the tools that are needed to countries over the next 12 months. Fully funding the ACT Accelerator is an essential component of WHO's Strategic Preparedness and Response Plan, our overarching plan for bringing the pandemic under control. Making these investments could save more than 5 million lives, primarily in low and lower middle-income countries. And they are a drop in the ocean compared with the cost of failing to end the pandemic. If the COVID-19 pandemic is not brought under control, the IMF warns that global GDP will be reduced by more than $5 trillion over the next 5 years. This weekend, the leaders of the G20 countries will meet in Rome. Together, these countries have the ability to make the political and financial commitments that are needed to end this pandemic and to prevent future crises. We are at a decisive moment, requiring decisive leadership to make the world safer. And I have 3 requests for the G20 leaders. First, fully fund the ACT Accelerator. Second, support the creation of an overarching framework for global health security through a legally binding treaty on pandemic preparedness and response. And third, support the creation of a health threats financing board supported by a financial intermediary fund hosted by the World Bank. Since we launched the ACT Accelerator 18 months ago, the government of Norway has been one of its strongest supporters, including as co-chair with South Africa of the ACT Accelerator Facilitation Council. It's therefore my great pleasure to welcome His Excellency Jonas Gahr Støre, the Prime Minister of Norway. Prime Minister Støre also once worked for WHO as Prime Minister. Welcome back to WHO, and thank you for Norway's support for the ACT Accelerator so far. Tusen takk, and you have the floor.
Director General, Dr. Tedros, it's a great pleasure for me to be back in the executive board room, which I can see there, and I'm really honored to be speaking with you in this fine organization that I was happy to serve under Dr. Brundtland when she was Director General. So, colleagues and friends, from a global perspective, we are in a different phase of the pandemic that we were when the ACT-A Facilitation Council met for the first time. We now have made progress. We have an effective vaccine, new effective treatments are being introduced, and rapid diagnostics make it possible to test for infection, identify illness, and reduce transmission. All that is good news. While a new normal is emerging for people who have access to COVID-19 tools, this is still a distant prospect for the majority of the world's population that you highlighted, Mr. Director General. Health workers and individuals in high-risk groups are vulnerable and particularly at risk. And it's worthwhile reminding that as long as some people are exposed and vulnerable, we all are in this globalized world. Without access to COVID-19 tools, we will not be able to achieve full economic and social recovery. And scientists warn us that the new viral strains may evolve. Inequities in access could lead to millions more deaths that could be averted. So the COVID-19 pandemic has increased inequities in a world that has plenty of it already. We must correct these. The ACT-A partnership is our best bet for doing so. So following the strategic review of ACT-A, South Africa and Norway as Facilitation Council co-chairs have proposed changes aimed at increasing countries' engagement. We want to strengthen the voice of low-income countries and of civil society. We are seeking to increase accountability and transparency on fulfillment of pledges made by donors, by industry, multilateral organizations, and others. So we call on the vaccine manufacturers to provide the required doses of vaccines in a transparent and predictable way. This is essential. We will support integration of efforts with important bilateral and multilateral initiatives. So, Director General and friends, promoting stronger global health collaboration and improving global health preparedness and response remain priorities for Norway, as they have done before the pandemic, during the pandemic and beyond. We want to reduce fragmentation in the area of global health. We also believe a more comprehensive and binding set of rules is needed to enhance the ability to prevent and respond to health emergencies. So, in short, why is this important? How can we learn from what we have been through? Well, I think first of all, it is a reminder so amply demonstrated that global health security is a global public good. Global health security is not just a health issue, it's a social, economic, and security issue as well. It should be, and it is really, in everyone's interest that we invest in vaccines, diagnostics, and treatment as a global public good. This is in addition sound macroeconomic policy and will help all countries to improve their chances to recover and build back better and faster. Norway has, for its part, contributed almost $500 million to the ACT-A. And I believe to say, Mr. Director General, that is more than our stipulated share. And I would take this opportunity to call on others to follow suit. In addition to financing ACT-A, countries must share vaccines doses through COVAX in line with their pledges and as quickly as possible. Facilitating the sharing of vaccines must be a priority for countries, Gavi, and the industry. Now, it is evident that we were not prepared for a pandemic when it hit the world as we entered 2020. Ad hoc solutions developed during the COVID-19 pandemic should be now replaced by sustainable, well-thought-through mechanisms for the long term. This is highly relevant for the G20 discussions later this week. I hope and urge that the G20 will make a commitment to end the COVID-19 pandemic and set out a pathway for achieving pandemic preparedness. Because this may happen again, and as we heard from experts, it will happen again in a different shape and form. We have to prepare for that. COVID-19 has demonstrated the risk to macroeconomic stability posed by the widespread outbreak of disease. Norway supports the establishment of an inclusive joint high-level political forum that can ensure better preparedness and response, to take political responsibility. The G20 can play, of course, a crucial role by initiating such an initiative. Mr. Director General and friends, I take this opportunity this afternoon, Oslo time, to say the following. Important global targets were set at the recent COVID-19 summit hosted by President Biden and Vice President Harris. ACT-A and the multilateral leaders task force must now do their part to ensure that those targets are followed up and ultimately met. The impacts of inequities in access to COVID-19 tools are obvious. We can all see them, observe them. It is our obligation as leaders to end this pandemic and do it in an equitable way. The new Act 8 strategy and budget is a plan for doing so. This is not a single country effort. This is a collective effort. And we must work together to ensure inclusive and effective implementation. So thank you, Mr. Director General, for letting me speak on this event, and I wish you all luck in your endeavor, and I salute your staying power and your ability to keep focus on this agenda, servicing your broad membership and the whole world. Thank you.
Thank you. Thank you so much, Your Excellency. Thank you so much, Prime Minister Støre. And thank you once again for Norway's leadership and partnership. Margareta, back to you.
Thank you very much, Dr. Tedros, and Your Excellency, Prime Minister from Norway. We've got quite a lot of you in the queue, but I see some people are not raising their hands, so I would all remind you, please raise your hands so that we know you have a question. The first question we have, the first person in the queue is Belisa Godinho, W Magazine, Portugal. Belisa, please go ahead and ask your question.
Thank you for taking my question. I'm Belisa Godinho from W Magazine Media in Portugal. Portugal has one of the countries to lead full vaccination, with the task force globally reaching more than 18% of the population. Today, the contamination rate has risen slightly. We know that some European countries are already starting to face new cases more seriously. What advice does WHO give Portugal in order to avoid a new outbreak of the disease? Thank you.
Thank you, Belisa. I think Dr. Maria van Kerkhoff will answer that one.
Thank you for the question. And yes, you have pointed out the situation in Portugal. It has very high vaccination coverage, and the case numbers are lower than they have been, quite lower than they have been over the course of this pandemic. But the death rate in Portugal is also quite low, very low, less than 50 per week or so, even though every single one of these deaths is tragic. With the high vaccination coverage, what we are seeing across a number of countries is that the intended use of the vaccines, as you know, is to prevent severe disease and death. And the COVID-19 vaccines that are in use are incredibly effective against preventing hospitalizations, preventing people needing admission to an intensive care unit, and dying. And I think what we see across Portugal and across many countries is, in fact, this is what is happening. The data is supporting that. So that is good news. But as you know, WHO's recommendation is, even though we are working very hard to address vaccine inequity around the world, working very hard to increase vaccination coverage, particularly among those who are most at risk in all countries, we still strongly advise on using other tools such as distancing, mask wearing, improving ventilation, avoiding crowds to minimize the spread. Because vaccines alone are not enough to end the pandemic. We've said this over and over again, and we will say it again. There are so many tools that exist right now. We have the tools at hand right now that can not only save people's lives, but can also drive down transmission. And this is what we would like to see. Europe has seen an increase in cases over the last 5 weeks, an increase in deaths over the last 6 weeks, and entering the autumn, we're in the autumn now, and entering the winter months where people tend to spend much more time indoors in close proximity, perhaps in rooms where there is not good ventilation, cases will increase. We have the Delta variant. The Delta variant is evolving. We are tracking more than 30 sublineages of this, so the pandemic will continue. We can end this pandemic. We can take out the severe disease and death with vaccination, but we can also drive transmission down with other tools. So please, regardless of vaccination uptake, continue to practice distancing, wearing of a mask, cleaning your hands, avoiding crowded spaces. We have to put in this work to end this pandemic. And the more we do this, the closer we will be to ending this pandemic.
Thank you, Dr. Van Kerkhoff. And Dr. Aylward has something to add.
Yeah, thanks. Also, just to emphasize that it is for It's for this reason that to Maria's point, that the new Act A strategic plan, it emphasizes again the integrated end-to-end approach, which is crucial to stopping this crisis. That axiom, again, proven true. We're seeing in so many countries, you can't vaccinate your way out of this. You've got to have those complementary tools. And that's why we want to make sure those are available, not only in high-income countries, but globally. Hence, as the Director General said, the importance of the G20 this weekend, looking at that Act Accelerator plan and saying, this is the minimum amount of money, $20 billion. Remember, we'll lose 4 times that every single month that it goes unfunded, but that's what it takes to do exactly what Maria said, ensure that full integrated approach in the countries that are going to need it most in the face of what is still a surging Delta virus in so many places.
Thank you very much, Drs. Van Kerkhove and Aylward. The next question, we will go to India for the next question, and that goes to Shivank Misra from Z News. Shivank, and I apologize if I pronounced your name incorrectly, please unmute yourself and ask your question.
Hi, this is Shivank Mishra from Z News India. My question to WHO is, as we are watching, there is a delay in approving process of Covaxin, our indigenous vaccine. While on every occasion or on every meeting, Covaxin is not getting approved on every meeting. Covaxin is only given new dates by WHO. Also, what we are seeing here is when it comes to Chinese vaccine, WHO has given approval to Chinese vaccine with lack of data, as in the case of Sinovac and in the case of Sinopharm. The World Health Organization has given approval to both of the vaccines as their efficacy was not established on 60-plus population, but still they have given the approval to those vaccines. So don't you people think that it's the classical case of partial approach of WHO on Indian vaccine?
Shivank,
and Chinese?
Can you ask your question? Sorry, we're running short of time. Is your question you'd like to know about the approval process for Covaxin? Is that correct?
Yeah.
Yes? I'll hand the question over to Dr. Mariangela Shamal.
Thank you for the question, and I think it's very important to highlight that the process that WHO uses for the issuing an emergency use listing are a very transparent process. They are on WHO's website, as well as the assessment. In WHO's website, there's also a table that's updated almost weekly when you have the assessment, the status of the assessment of each vaccine that has been submitted for an emergency use listing. For WHO, that includes the date that the process started and when it was finalized. So there's no secrets on this, except for the confidential information. Everything else, the procedures that WHO uses are independent of which countries is manufacturing the vaccine. First of all, I think we want to reassure that, and it's based on the best international standards available. Now, the process the way it works, it's important to clarify again. The manufacturer does submit to WHO data, the information. The internal experts analyze the data. Sometimes WHO needs to inspect the manufacturer if it hasn't done an inspection in the short term. It wasn't a short time ago. It wasn't the case of Bharat. We did not need to inspect Bharat. Then once WHO the manufacturer has completed submitting all the data to WHO, and let me say that Bharat has been submitting data regularly and very quickly, but they submitted the last batch of data on the 18th of October. And once that is done, WHO puts for the assessment of an external technical advisory group. This technical advisory group for the emergency use listing is comprised of experts from 6 different nationalities, and they look at all the data that has been collected by WHO and provided by manufacturer and recommend the listing, or in occasions, and it happened with the 2 Chinese vaccines that were mentioned here, they can ask for additional clarifications, and that was what happened On Tuesday, on the 26th, when this technical advisory group met, they asked for additional clarifications, and they are meeting next week on next Wednesday, again to analyze, and we are in touch daily conversations with Bharat, calls and meetings, clarifying what additional data needs to be put to the expert group. Let me just clarify, and without wanting to mention any specific manufacturer, but saying that we have assessed an Indian manufacturer earlier in the year, and it took 30 days. And we are now in the vaccines from China. They were the assessment followed this entire process I just described. And one of them was issued emergency use listing 1 month after the first technical advisory group meeting, and the second 6 weeks later. So this is not about moving quicker with one or another vaccine based on precedence. We really trust the Indian industry. India produces the majority of vaccines in the world, high-quality vaccines. We are right now at the last stage of the assessment by this external advisory group, and we hope to have a final recommendation to WHO next week. I hope that's well understood.
Thank you so much, Dr. Shumao, and Dr. Aylward will add some comments as well.
Thank you so much, Shiva, for flagging the issue. I do want to highlight, though, in the stressful situation we're all working under in this pandemic, it is so important that we're accurate in the information that we use and that we share. And we just want to highlight, I'm going to be on the record, that there were a number of inaccuracies in the way the issue was presented. And I want to highlight again that Mariangela said and was clear, the actual information around dates, process is actually all available transparently on WHO's website. So just to all journalists, again, you've been so fantastic in this response, so important, such conduits for accurate information to make sure there's no misrepresentation on such an important issue as the speed with which we get any promising vaccine available for use. We're committed, the organization from the very top under the Director General, to move these processes as rapidly as possible. But let's be very clear. The timeline for EULing a vaccine depends 99% on manufacturers, the speed, the completeness with which they can get data to the independent groups that assess this for WHO. So we just want to be very, very clear on that point. Our job is to save as many lives as possible, as fast as possible. That means making sure no product lies unused. And those processes under Mariangela's leadership move as fast as possible. Certainly the organization does everything. We need manufacturers, the regulatory agencies, others we work with to make sure they have the information they need to make those determinations. We need to make sure the products are safe and effective and produced to the right quality. And that takes a little bit of time, but it's in the interest of global safety.
Thank you, Dr. Aylward, and Dr. Swaminathan will add something as well.
I would just like to make one additional point to what's been said by Dr. Simao and Dr. Aylward. I think one of the reasons for the high amount of stress that people who've received vaccines which are not yet approved either by WHO or by any of the other main, the stringent regulatory agencies is because of restrictions in travel that have been imposed. And I just want to reiterate that the emergency committee that reviews the international health regulations met again last week. They meet every 3 months or so to review the status of the pandemic and have again reiterated, they have underlined their previous recommendations that countries should not use vaccination status or selective vaccination status as the sole criteria for entry for travel. So you could use a vaccination status but also a negative test prior to entry or proof of a previous test, and many countries accept one or the other. And therefore vaccination status should not be a barrier to global travel, because that is just actually increasing the inequities around the world. There are large parts of the world where people do not have access to vaccines or who have received a vaccine that's not yet approved by all countries, And that should not be the criterion whether that individual can travel to other, because there are other ways of minimizing the risks of transmission. So just wanted to make that additional point, because that is right now leading to a lot of stress around the world.
Dr. Shamal will add some more. This is such an important topic. We thank you for asking the question.
Oh, sorry. Just a quick complementary information is that at the moment, including Bharat, WHO is assessing 8 vaccine candidates. So this is a process that's very quick. We have teams now in countries doing inspections, and we understand this is an urgent matter. And just to say that based on the information that's available online in WHO's website, for example, Bharat started the rolling submission on the 6th of July. And we have several vaccines that are entering now in August, others that started in July and September. So this is an ongoing process. So I think it's very good because it helps countries. It also helps having WHO, the emergency use listing by WHO, also helps the registration at country level for the regulatory approval, right? So what we call the reliance and during this year, there was a period where in 15 days, because of the vaccine being listed by WHO, 101 countries were able to do the registration at country level. They authorized the use of the vaccine at country level. So this is we are treating this as a very urgent matter, and we have teams working 7 by 7 on the topic. Thank you.
And I've seen round the clock, they work and work and work. The next question goes to Simon Ateba from Today News Africa. Simon, unmute yourself, please, and ask your question.
Thank you for taking my question. This is Simon Ateba with Today News Africa in Washington, D.C. The WHO Africa Department said this morning that just 5 African countries, less than 10% of Africa's 54 nations, are projected to hit the year-end target of fully vaccinating 40% of their people. It seems Africa is being left behind again. What's your reaction? And if I may quickly add, the Biden administration announced this week that everyone coming to the United States from November 8, we need to provide proof of COVID-19 vaccination unless they are children. And in that case, we need to show a negative COVID-19 test from November 8. I know you oppose vaccine mandate, but are you satisfied with the requirement for kids? Thank you.
Thank you, Simon. Dr. Swaminathan will begin to answer your question.
Thank you, Simon. I can start. I'm sure others will come in. So to your first point, yes, we are very concerned, and this is something the Director General and the regional directors have been highlighting time and time again, that at the rate at which the vaccines are flowing through COVAX and through the African Vaccine Acquisition Task Force, it's going to be very difficult for countries in Africa to make the 40% coverage targets that, we have ambitiously put before the world by the end of this year. And as was pointed out in the DG's speech today, we have enough vaccine production in the world. In fact, if we had shared the 6.8 billion doses of vaccines equitably, we would have had 40% coverage everywhere by now. So the issue is prioritization of those parts of the world that don't have adequate vaccines. I want to put another fact before you. Today, the number of boosters that's being administered around the world, close to 1 million jabs a day, is 3 times the amount of vaccines being administered in low-income countries, which is about 330,000 doses a day. 62 countries have started administering boosters, and more are thinking about it. The WHO had called for a moratorium on boosters till the end of the year, so we could move those vaccine doses to those countries and to those populations that are still below 4 or 5% coverage. Even the frontline workers have not been fully covered. So it is doable, it is possible. And we hope that, again, the G20 leaders will take decisions on how to use existing supplies, how to prioritize them to parts of the world which need them desperately, and also to support manufacturing at additional places around the world through the WHO manufacturing hub, and make sure that there are no export restrictions and for raw materials and ingredients. So there are multiple steps. There have been pledges of over 1 billion doses in donations, but we've only seen about 14 or 15% of those donations actually flowing through COVAX or bilaterally. So we can do much more on each of those fronts to address the important issue of vaccine inequity.
Thank you, Dr. Swaminathan, and Dr. Bruce Aylward will add as well.
Simon, thanks for highlighting this issue. But let's be clear, it's not just Africa. There are 82 countries in the world that are at risk of reaching 40% coverage of their populations by the end of 2021, only because of a lack of supply. So let's be super clear on that point. So it's not inevitable, Simon, like you said, to say that these countries won't meet it. They can meet it if the supply is there. And let's be very clear, those 82 countries only need an additional 550 million doses through the COVAX and other mechanisms to hit that target. So the big question to the G20 this weekend is, are they going to say, here is where that 550 million doses are going to come from, because those 20 countries control the global vaccine supply. And I'm sorry to be as frank as that, but remember, between now and the end of this year, we're going to make another 3 billion doses of vaccine. Can we take 550 million doses of that, about 10 days of production, and make sure it goes into COVAX and the other mechanisms that can get the equitable distribution, that by the end of this year we'll see more lives saved, more livelihoods on track and saved as well, and get the end of this pandemic. So this is a very solvable problem. These numbers are not daunting. It's an issue of the will and the manufacturers cooperating then to make sure the doses go where they're needed. This is the test of the world's solidarity. Do we commit in 3 days' time to say, here's the roadmap to get to 40%? Do we implement that?
Thank you very much, Dr. Aylward and Dr. Swaminathan. The next question will go to Geneva, to Priti Patnaik of Geneva Files. Priti, please unmute yourself and ask your question.
Hi, thanks so much for taking my question. My question is, whether Merck approached CTAP for the licensing of molnupiravir, and whether there were any consultations between CTAP and Merck, whether any attempt was made to sort of get Merck to consider a more open licensing approach as opposed to a more limited licensing model agreement that has been signed with MPP. Thanks so much.
Thank you, Priti. And Dr. Mariangela Simal will answer your question.
Thank you, Priti. Norway, actually, Merck approached the CTAP partner, which is the Medicines Patent Pool, a few months ago, and the licensing was finalized yesterday. So it had not approached. We had discussions with Merck, but Merck was already going through bilateral agreements with 7 or 8 generic manufacturers already, and now finalize the Medicines Patent Pool approach. Let me say that the licensing through the Medicines Patent Pool is very much welcomed by WHO because it's an open, transparent, public health-oriented license, and the Medicines Patent Pool is a partner on CTAP. Thank you.
Thank you very much. Oh, Dr. Tedros.
Okay, just a comment also to supplement what Mary Angela said. So this is a drug that we are currently evaluating, and we met with Merck on Friday to discuss the data from it. There are currently clinical trials that are underway in other countries. We expect to see that data in the coming days. Our timeline for the development of guidance for new therapeutics, and this is reported to have a reduced risk of hospitalization for patients who are on the mild to moderate end of the spectrum of COVID-19. So this would be good news. This is welcomed news. Our aim is to get the guidance out from the point to which we have the data to the guidance being published of 8 to 10 weeks. But it depends on our access to the data to see the data from all of the clinical trials to evaluate it together. So it's a combination of efforts, and the clinical team, and working with partners around the world, principal investigators from those clinical trials who are carrying those out to work directly with us. And we're very grateful for that collaboration to share that information with us in real time. So we hope to have some good news there in the coming weeks.
Thank you very much. And on that very positive note, Dr. Tedros will now close the meeting.
Thank you, Margarita. Finally, we're proud today to launch the third edition of the WHO Health for All Film Festival. As you know, the first two editions of the festival were very successful, attracting an average of 1,250 films from 110 countries. Last year's winning films tell powerful stories about people facing health challenges of all kinds, from female genital mutilation to rheumatic heart disease, from leukemia to disabilities, and about the health workers who have devoted their lives to protecting people from COVID-19. This year's call for films opens today and will close on the 30th of January next year. We invite independent filmmakers, production companies, public institutions, NGOs, communities, students, anyone to submit original short films of 3 to 8 minutes. Like last year, there are 3 themes matching WHO's 3 strategic priorities: universal health coverage, health emergencies, and healthier populations. A Grand Prix will be awarded in
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.